everyone. Welcome on board. This is Nena Otaloka. I'm a nurse practitioner and I'm one of the owners of Advanced Practice Learning and Resource Group. Our Facebook group gives advanced practice providers and students a platform for knowledge sharing and clinical skill improvement. And I'm here with my partners, Ada Ojide. Ada, say hello.
Hi, everybody.
Yeah.
Okay. Oh.
Ada is a nurse practitioner as well. And Rachel.
Hello, everyone. My name is Rachel Iribor. I'm an emergency medicine and physician assistant, as well as have experience with telemed as well.
Oh, awesome. Well, today is a very special day because we are going to explore the world of telemedicine. As you all know, it is a hot topic, and we are excited to introduce you to Dr. DePasquale. She is a board-certified family medicine physician, an expert in telemedicine, and a mother of 3, and also an advocate for NPs and PAs. She is also a founder of Collaborating Docs. This company helps NPs and PAs create their own practices. She also has a course. It's an online course. It's titled Learn How to Create Your Own Telemedicine Practice as an Advanced Practice Clinician. And this tells you about how to it tells you about how to create and grow and scale your own business as an advanced practice clinician. Welcome, Dr. DePasquale.
Thank you. Thanks. I'm really excited to be here with you all. I think we'll have fun in the next little while talking about telemedicine, how it's a great opportunity for NPs and PAs.
Awesome, awesome. And we have some questions we want to ask you. And first of all, tell us about yourself. Tell us more about yourself and why you recommend telemedicine to NPs and PAs.
Sure. Yes. So I thank you for the introduction. I am a family medicine doctor. I've been in practice just about a decade now. I started my whole career, well, pretty much my whole career, I've been working in Washington, D.C. at a federally qualified health center sort of system. And it's been a great experience. And this is actually my connection to nurse practitioners in particular, that my first boss was a nurse practitioner. She was the medical director of the small clinic in DC. And then I sat next to a different nurse practitioner who was very experienced. So with Lisa and Teresa, honestly, I mean, you learn, of course, you learn in school, you learn in residency, but it's the real world where we all learn so much about how to take care of patients. And I learned it very much from the two of them, taking me under their wing and sort of teaching me the ropes of, reality and real medical care. So I've always been indebted to nurse practitioners since that experience. And I've always helped nurse practitioners and PAs on the side. While I was working in DC, I always had a few collaboratives, in the real world that were doing their own independent thing that I would help, over the phone or video. And it's grown. So now I do own and run a company that you mentioned, Collaborating Docs, that we sort of play matchmaker, and we connect nurse practitioners and PAs with supportive doctors who are experienced and really like helping advanced practice clinicians. So it's really my whole life. And I did build this course about telemedicine recently because, well, for many reasons, but one, I do think telemedicine is a great avenue for NPs and PAs in particular. And this is the time, right, with COVID, everything suddenly has shifted to being online. So this is, you want to kind of claim your stake or put your stake in the ground and say, this is my territory. I'm running my practice, and get it going now is an ideal opportunity, really. So we'll talk more about the course, I'm sure, over the next few minutes, but if you're interested, I do have a nice 10% discount code, and we can give it at the end if you want, for the course for people.
Yeah, that's fantastic. Fantastic. Okay.
Thank you,
Well, that's
guys.
great. That's great.
Sure.
Thank you very much for that. And how do we get started? How do we get started, doing this telemedicine?
Right. So that is the big question. I like to tell people, I do a lot of consulting as well and sort of guide people on the right path. I think there's really two paths. As an NP or PA, you can find an actual job, like either a salaried job or a contractor job, working for another company, like a bigger entity. Luckily, a lot of telemed companies are recruiting pretty heavily for advanced practice clinicians. So I know many companies out there. You can do a quick Google search and you can find opportunities that are laid out in front of you. They're looking to hire. So that's sort of the more traditional route of finding a job. You can look online or indeed.com and find these opportunities. But I am a big proponent of the second path, which is becoming an entrepreneur and making your own practice, your own business. There's so many reasons, but number one, you're the boss. You make the decisions. You're not answering to anybody else. So you get to build your telemed practice the way you want it. If you want to treat teenagers who have depression or anxiety or something, I mean, it's your decision of who's your audience, who are your patients, and build it. You can really build a brand around it too. That's a big thing I promote. So whatever sort of topic or conditions you want to treat, that will be your whole life. I mean, your social media will be all about, I am the expert in acne. I'm the acne go-to person, at least in my state where I'm doing telemedicine. Become national, that's a whole other level, but and not that it can't be done, but I would start like locally in your state and say, well, I'm going to be the go-to person for lactation consultants, or for teenagers who are obese, or for diabetic patients whose A1C is out of control. Like, you'll be that go-to person. So I would just say those are sort of like the two paths, and you probably just want to look inwardly. Like, are you someone that would rather it kind of be given to you? Here's your job, here's your pay. There's no risk. It's just do the work and get paid. Or are you someone kind of like a dreamer? Like, I want to build something big for my family, my life, fits on my schedule. I call the shots. I work from home. Well, I guess both are working from home with telemed, but more that you're master of your own destiny. So it's not one wrong or right. I think you just have to look at which route is better for you personally.
Okay, that's wonderful. So Ada has more questions for you. And Ada, well, you said you would like to ask Dr. DePasquale a few more questions.
Yeah.
Take it from there.
Okay. So Dr. Pasquale, I really love what you said about being a master of your own destiny. I'm a proponent of having your